To the Education Workforce Committee. As a physician, I like to try to focus on patients. As you well know, I want to focus on one specific patient. Occasionally we have the opportunity to truly affect in a singular and specific way somebody's life, and Madam Secretary, I would suggest that you have that opportunity with Sarah Murnahan. Sarah Murnahan, as you know, is a 10-year-old young lady in Pennsylvania who has cystic fibrosis. The physicians and scientists have all agreed that if she does not receive a lung transplant within weeks, she will die. Doctors all agree that it's indicated. The reason she's unable to receive that right now is because of an arbitrary rule that says if you're not 12 years old, you aren't eligible to receive an adolescent or an adult lung. Madam Secretary, under Section 121.4D, you have the opportunity. It says, quote, unless the Secretary directs otherwise based on possible risk to the health of patients or public safety, unquote. Madam Secretary, I would urge you this week to allow that lung transplant to move forward.
Well, Dr. Price, I appreciate your input. First, as a mother and a grandmother, I can't imagine anything more agonizing than what the Murnagans are going through. And I talked to Janet Murnagan, the mother of Sarah, about this case. What I've also done is look very carefully at the history of the rules around lung transplant and organ transplant.
Madam Secretary, it simply,
Dr. Price,
I'm going to reclaim my time. It simply takes your signature. It simply takes your signature. A study I know you have ordered, and I appreciate that, but a study will take over a year. This young lady will be dead. I want to move on to a concern that many, Madam Secretary, I want to move on to a concern that many folks across this country have about this administration and about the things that are being done outside the norm and certainly some believe outside legal limits. The Washington Post and the New York Times reported last month that you were soliciting funds from the health industry officials to support the implementation and enrollment in the Affordable Care Act. Is that true?
No, sir, that is not true.
So you didn't communicate, have any discussions with folks at the Robert Wood Johnson Foundation or H&R Block about donating?
You asked me if I solicited funds from anyone in the health industry, and I said, no, that is not true.
Did you have any discussions or conversations with anyone about providing resources to anybody about enrollment or implementation of ACA?
Sir, I have had conversations with people all across this country, including insurance companies, pharmaceutical companies, and others, using the statutory authority that is clearly given to the Secretary of Health in the Public Health Service Act and has been used by my predecessors, Republican and Democratic, for every health innovation that has gone on. Secretary Thompson and Leavitt made public-private partnership outreach efforts to make sure Medicare Part D enrollment went well.
So you did ask individuals to assist in providing contributions for the implementation and enrollment of the ACA?
I have made 2 calls involving funding, to Robert Wood Johnson and H&R Block, neither of whom are under the regulatory authority of our office. But I would suggest that the Public Health Service Act does not limit my authority to entities that are not regulated. I chose to do that.
What did you request of Robert Wood Johnson Foundation and H&R Block?
I talked to them both about how important this outreach effort was going to be and the fact that always we anticipated having public-private partnerships on the ground, as has been done in CHIP enrollment and in Medicare Part D enrollment, and that they consider making contributions to our partner in Enroll America, which is a private, not-for-profit, nonpartisan organization incorporated in 2012 under the umbrella of Families USA.
Did you ask them to provide resources for any other group at all?
I did not, because at that point I did not know that there were other groups soliciting funds. I talked to them specifically about Enroll America.
Did you have any conversations with employees or representatives or designees of the pharmaceutical industry? Have any conversations with employees or representatives or designees of the pharmaceutical industry to contribute resources to Enroll America?
Those are the only two conversations I've had about contributing resources to Enroll America. I've certainly promoted the partnership role that Enroll America will play in an operation on the ground, much similar to, I would suggest that you look at the ABC, the coalition that was put together for Medicare Part D that Secretary Thompson and Secretary Leavitt avidly supported and traveled around with and suggested that they were very important public-private partners. It's the same kind of effort. We're also talking to businesses and pharmaceutical companies and hospitals and insurers and faith groups about using whatever resources they have to help fulfill what I consider to be an incredible opportunity for up to 30 million Americans to have affordable, available health coverage.
Direct any of those other entities to Enroll America?
The gentleman's time has expired. Mr. Andrews.
Secretary Sebelius, I want to talk a little bit more about the